Okay, we're back from the break, and again, remember Ray's question and the phone line underneath there. So he asked, can a cold progress to pneumonia? And the answer is again, yes. 1 out of 10 usually, depending on your level of health prior to getting a cold. The best thing you do is to prevent colds, good hand washing, try not to touch your face, try to be careful of doorknobs. Again, a lot of people use those hand cleansers, just use this part if that's what you're going to do. Soap and water has worked for years. Obviously, when you're around people that cough and things of that nature, if they cough in your face, you're going to get a cold. The other thing is if you have a non-productive cough, a dry cough, then yes, a cough suppressant will work. If you have a productive cough, please do not take a cough suppressant. That would set you up for pneumonia possibility by not letting you have what's called a pulmonary toilet, and that would be the clearing of the mucus from your deep inside your lung. So I hope that answered that question. And yes, if you are ill, please do get in to your doctor as soon as possible so they can get you started on the appropriate antibiotic. Now, one of the things that sparks a little thought in my mind, which is the use of a particular antibiotic that a lot of emergency rooms use, a lot of the urgent cares use. It's called the Zithromax. It starts with a Z, and you can always have Max on the back of it, or a zithromycin. So a Z-Pack or a zithromycin. You want to remember those names. Do not, under any circumstance, let someone prescribe that for you with a cold or bronchitis. And I will try to explain why. The reason they do it is because it's 5 pills and it's really easy to take and things of that nature. But there are only 3 bacteria that are cured with azithromycin, and they are all intracellular bacteria. And what do I mean by intracellular? That means they grow inside the white blood cells or inside the cells of your tissue. Those would be Legionella. Now, Legionella can cause a pneumonia, but not a bronchitis. But Cipro and some of the other antibiotics are also very effective against that, and there are better antibiotics that will do the same thing, that will kill the intracellular bacteria, but will kill a lot more. So I will get to that in just a moment. So remember, Zithromax or azithromycin. 5 days, you'll take 2 pills one day and 1 pill the next day. I made a choice to use it when it first came out in the 80s, 90s. They promulgated it for strep throat because it was a macrolide, and a macrolide is an erythromycin type drug, and because they give it to penicillin allergic patients, it's very effective. It's an erythromycin based drug, or what they call a macrolide. So it's one of those products that it's easy, compliance is good. Remember, if you take a pill once a day, you'll remember to take it about 90% of the time, but it drops off pretty substantially from there if you go to BID, which is twice a day or 3 times a day. So the problem with Zithromax is, again, it is an intracellular bacteria. So what it does is it gets into your stomach and then gets into your bloodstream, and it has this small little spike of about 2 hours where it's in your plasma. What is your plasma? Your plasma is your blood. It's your proteins, okay? And then as it goes from the plasma, it goes inside your white blood cells. So what if there are no bacteria inside the white blood cells? So now you've created this reservoir of antibiotic in an area where there are no bacteria, and it's basically worthless as far as that. Not only that, it lasts in your tissues a lot longer than it lasts in your serum. So if you happen to be allergic to Zithromax, you could have an allergic reaction forever, it seems like, before you could get rid of it. So again, Legionella, chlamydia, which is another intracellular organism, but it's really there are chlamydia pneumonias, but they're very, very rare. But most of the chlamydia infections are below the belt, even in females. causing an infection of the cervix, and in males causing a non-gonococcal urethritis or a small discharge with a little bit of pain on urination. You have erysipelas, which is another intracellular bacteria. Rarely does it cause a bronchitis. It causes more of a genital infection. So Zithromax is really a below-the-belt antibiotic. It really treats those infections more common to see in what we call sexually transmitted diseases. So what's the sense of giving it for your bronchitis when it's really treated for below the belt? And not only that, it actually, because it hangs in your system for such a long time, it actually selects for resistant organisms to erythromycin-based drugs. So again, do not, under any circumstance, use Zithromax unless you have one of those three bacterial infections or you're insured. If it's below the belt, then yes, that's fine. It would be like giving you a shot of penicillin for that. Now, I don't know if it's susceptible to syphilis or gonorrhea. It might be, but it's really for those three intracellular organisms. So there is a basic rule of thumb that we use for antibiotics, and what this is, and I've talked about it on previous shows, it's called the MIC, and it's not the MIB or Men in Black, but MIC as in cat. It stands for minimum inhibitory concentration. Now, every bacteria has, along with an antibiotic, has an MIC, and what that is the plasma or concentration, the minimum inhibitory concentration that you need to attain in order to become bacteriostatic or possibly bactericidal. But most of the antibiotics today are what we call bacteriostatic, and what that means is they basically control the growth of the bacteria until your white blood cell system can get in there and kill all of the bacteria. Now, if you didn't have an active immune system, you basically would not kill any of the bacteria that invade your body or the opportunistic bacteria. And I say that opportunistic because we're colonized with millions and billions of normal bacteria in our body. And normally those bacteria keep the bad bacteria in check. So that's why it's always dangerous to use the indiscriminate use of antibiotics, because you actually will kill the good bacteria and then the bad bacteria will have a chance to grow. Remember, they're already resistant, and all bacteria compete for food supply and nutrients in your body, and when they don't have them, they basically die off. And if you're too clean, like we talked about, you will select for opportunistic infections like methicillin-resistant staph, and other things, because now you've allowed these dangerous bacteria to grow and you've killed all the good ones. So in order for an antibiotic to be an effective killer, its minimum inhibitory concentration has to exceed, the plasma concentration has to exceed the minimum inhibitory concentration for greater than half of the dosing interval. Now, I know that sounds like a tongue twister, but I want you to think about what this means. If I gave you an antibiotic every 12 hours, then that means its plasma concentration has to be greater than the MIC for 6 hours. If I give it to you every 4 hours, then it only has to be greater than for every 2 hours. It has to be greater than MIC for 2 hours. And so how often do they give you Zithromax? Every 24 hours. And how high is the MIC, the plasma concentration above the MIC? For most cases of bacteria, 2 hours. So it's a very ineffective bacteriostatic antibiotic. Remember, the plasma concentration, or what you can measure in your blood, has to be greater than the MIC, which is the minimum inhibitory concentration, for half the dosing interval. So that means it would have to be above that for 12 hours if you're going to give it every 24 hours. And that is not the case. That's why the antibiotic simply does not work for anything except for intracellular bacteria, because it's concentrated in the white blood cells. So there, it does exceed the MIC for almost the entire day. So that's why it's very effective for that. So again, when you go to the emergency room and some doctor hands you a prescription for Zithromax and you were listening to the show, I'm going to tell you two things. First of all, that guy doesn't, or that lady does not understand the use of Zithromax. That's the first thing. And second of all, you should ask for another antibiotic. One I would suggest is Biaxin or clarithromycin. It is a macrolide, and it actually it's given every 12 hours, but it exceeds the minimum inhibitory concentration for probably almost the full dosing interval, because not only is the antibiotic itself bacteriostatic, its metabolite is also. So you get this double peak, and it's very effective. And I use it in 250 milligrams because usually in 500 it tends to cause a bad taste in your mouth and maybe upset your stomach. And it's not because it irritates your stomach, it's because it basically stimulates the nausea through a central nervous mechanism. So again, remember, do not take Zithromax if given to you unless you have one of those 3 bacterial infections below the belt and you're allergic to everything else. Okay, fine. Then Zithromax may be the only antibiotic you can really take. In that case, maybe double up or take it a little bit longer or a little bit quicker than you need. Adjust the dosing interval to try and get you what you need. So that's something I've been meaning to talk about a lot on this show, because I see a lot of patients come into me from the urgent care. They've been given a prescription for Zithromax, and it's like, ugh, it just doesn't work. And you always have to end up retreating it. You always have to give a second antibiotic. And you don't want to come back with Biaxin because they've already taken a macrolide. Now you got to use something like Augmentin or one of those other drugs. So anyway, hope you like that explanation. We're going to take a small break. And when we come back, if we don't have any further questions, we'll talk about health screenings for the year. Thank you for tuning in.